In this video, we'll discuss about inflammatory bowel syndrome. Basically, as we all know, inflammatory bowel syndrome has two components. One is the Crohn's disease and one is the ulcerative colitis. Now, Crohn's disease is the chronic granulomatous inflammation of the terminal ileum and the colon, resulting in stricture formation, ulceration, fistula formation, and abscesses. Whereas ulcerative colitis, it is basically the chronic recurrent inflammation of the rectum and the chronic mucosa. There is the difference between the sites that are involved. Baki both are chronic inflammations. Okay. Now I will tell you some of the differences between Crohn's disease and ulcerative colitis and an easy way to remember them as well. So first of all, coming on to the symptoms. In symptoms, what we see is we see diarrhea, pain in abdomen, in the right lower quadrant with tenderness. Now in this what you will see is there will be diarrhea, there will be blood, mucus, pus, there will be abdominal pain and fever, but here it is in the right lower quadrant. But here what you will see is it will occur in the left side, basically towards the left iliac fossa. Okay, this is the difference. Okay, ulcerative colitis is towards the left side, the pain is towards the left side, and Crohn's may it is towards the right side, right lower quadrant. Now coming on to the palpation, here it is palpable, ulcerative colitis is not palpable. Now coming on to colics or diffuse pain, they are recurrent, not here, absent. Then signs and symptoms. In this, what you will see is same diarrhea you will see. Then you will see malabsorption, anemia. But here, what you will see is there will be severe diarrhea. Okay, so there will be tenesmus as well, and there will be weight loss. And malabsorption is less common. Okay, here malabsorption is very common. Here malabsorption is less common. Okay, now we will discuss about the some complications. Now in complications, you can remember the complications by an mnemonic as chars. Okay, so by C what I have is the CIN, carcinoma in situ. It is less common here and it is common here. By H what I have is hemorrhoids. Now it is common here and less common here. By A we have the abscess and fistulas. By R what we have is relapses. By S we have stricture or anal fissures. Now I want you to remember, see, CIN will only be less common in the Crohn's disease. Rest all of them will be common. Just remember this way, and this will be less common. It's an easy way to remember. Okay, we covered the complications. Now coming on to the extra-intestinal manifestations. To remember the features, just remember a person named as Jessel. Remember the spelling of Jessel. Okay, so here J stands for joints. In joints, what you can have is arthritis, arthralgia. Then by E, I have I. In I, what we can have is we can have uveitis, episcleritis, conjunctivitis. Okay. By H, heart. In heart, what you can have is mitral valve prolapse, also aortic regurgitation. In S is skin. So skin में erythema nodosum, and pyoderma gangrenosum. By L, what you can have is the liver. So here you can have hepatitis, fatty liver, secularizing cholangitis. Now an easy way to remember first three will be less common. So less common, less common, less common. These will be common. Then reverted, common, less common, less common. Okay, so this is the symptoms, the complications, and the extra intestinal features. Now we will refer to the histopathological picture. In histopathology, first we will refer to the macroscopic and then we will refer to the microscopic. So now coming on to the next part of the same thing. So yeah, so come here, from here we will do the histopathology. So macroscopically. So macroscopically, सबसे पहले we will consider the site of lesion. Okay, site of involvement. So basically, as I told you before, this is going to be in the terminal ileum and right side of colon. and this is going to be in the rectum and sigmoid um, colon. Yeah. So sigmoid colon. Now, type of involvement. In this, what you will see is a very characteristic thing that you must remember is the skip areas. That is, it is discontinuous. That is, this is continuous. Now, appearance. In appearance, what you will see, the ulcer appearance of the intestinal mucosa, what you will see is you will see cobblestone appearance. Okay. Whereas here you will get to see polyps and pseudo polyps. Then ulcers will be deep and non-hemorrhagic in the case of Crohn's disease, whereas they will be superficial and hemorrhagic in ulcerative colitis. Then coming on to ulceration, the stricture, the fistula formation, as I mentioned in the definition as well. So it will be common in the Crohn's disease and it will be less common in the ulcerative colitis. Now we did it macroscopically. Now we will consider microscopically. In microscopically, you can remember something like wiggles. So just remember the spelling. They're a bit different. Wiggles. Just remember it this way. So first is the width of mucosa. In this it will be normal, in this it can be normal or it can be decreased. Then inflammation transmural hair, and it will be mucosal and submucosal in the ulcerative colitis. Then by G we have goblet cell population. Normal hair, it might be decreased hair. Okay, then coming on to the L. By L what we have is lesion. Now it is a non-caseating granuloma. Okay, and here it is absent, the non-caseating granuloma. By C what I have is crypt abscess. So it is infrequent in the Crohn's disease and it is frequent in the ulcerative colitis. So to sum up again, we will consider the differences. First of all is the difference between the symptoms. In symptoms, what we see is in the Crohn's disease, it occurs in the right lower quadrant, whereas here it will occur in the left sided. Okay, then palpation may Crohn's disease may hoga. Then colics is recurrent. Then signs and symptoms. Now here malabsorption symptoms will be more. Here they will be less. There will be diarrhea here as well as here, but it will be severe in the ulcerative colitis. Then complications may, just remember this. Now by C, CIN, hemorrhoids, then abscess and fistulas, R say relapses, S strictures. So just less common is this thing, and then common. Okay, then extra-intestinal. Remember a person named as Jessel. So joint, eye, heart, skin, liver. Okay, less common. First three less common and all others common. Remember the lesion specifically. Then in the histopathology, macroscopically, there is very important difference in the site. It is terminal ileum and right side. Here it is rectum and sigmoid column, basically the left side. Okay, so skip areas. This is very characteristic. A lot of questions come from here, and it is continuous. Then cobblestone appearance is also a keyword. Then ulcers, yes, they will be non-hemorrhagic, whereas they will be hemorrhagic in the ulcerative colitis. Then coming on to the ulceration stricture formation, as mentioned in the definition, it will be common in the Crohn's disease and less common in it. So by microscopically, remember this wiggles. So width of the mucosa, inflammation, then we have goblet cell population, then lesion, and then we have crypt abscess. So width is normal, inflammation is transmural, mucosal, submucosal, normal. Lesion, yes. Lesion, remember it is a non-caseating granuloma, whereas it is not a non-caseating granuloma in the ulcerative colitis. And crypt abscess is infrequent in the infrequent in the Crohn's disease and frequent in the ulcerative colitis. So this completes the difference between the ulcerative colitis and the Crohn's disease, two parts of the inflammatory bowel syndrome.